This podcast and content posted by Dr. Judith is presented solely for general informational, educational, and entertainment purposes. The use of information on this podcast or materials linked from this podcast or website is at the user's own risk. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional diagnoses or treatment. Users should not disregard or delay in obtaining medical advice for any medical or mental health condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Kody Green is a motivational speaker, podcast host, and content creator with over 1.5 million followers across social media. He has struggled in the past with drug addiction, incarceration, and serious mental health issues, as he has a diagnosis of undifferentiated schizophrenia. He joined me on The Vault this week to discuss how schizophrenia looks so different in different individuals, how he was a caretaker to his mother with schizoaffective disorder, and then he developed symptoms of schizophrenia, and how he overcame self-medicating in order to take charge of his life after being incarcerated with severe mental health issues. We talked about the stigma that people have about living with serious mental health issues, how to support loved ones who don't believe that they have a mental health condition, and ways to advocate for mental health care. Kody also discussed how becoming a social media presence has been both a blessing and at times a challenge, and how to cope with being judged by people because you live with mental illness.
I get a lot of people that fake claim. They claim that I'm using schizophrenia as a way to become popular on the internet. They're more willing to believe that a person is like faking schizophrenia than someone is living a somewhat comfortable life with medication and treatment. That's how bad the stigma is around schizophrenia.
This is an incredibly inspiring episode of The Vault. Kody, thank you so much for coming onto The Vault today.
Yeah, thank you so much for having me.
I've been following you for a while, but I'm really glad that we're having this conversation because we have a mutual friend, Michelle, and you are both advocates in terms of people living with schizophrenia who are doing incredible things. And I think it's so important for people to see that because, I mean, at least in my practice, I explain schizophrenia is a range, just like depression is on a range, anxiety is on a range. Tell us about how you decided to become an advocate and about your journey.
Yeah, so, I mean, I feel like advocacy wasn't something I necessarily sought out. Schizophrenia had been such a big part of my life, not only as a patient, but I was also a caregiver for many years for my mom who has schizoaffective disorder. So years before I ever showed any symptoms of schizophrenia, I had already known a lot about the illness through my mom's diagnosis. And so between, becoming a caregiver at a very young age for my mom and then going off to college just to go through my own, episodes of psychosis that would eventually lead to my schizophrenia diagnosis, it's been, a majority of my life that I've been living with or around schizophrenia. And so when I started doing social media, it was just like a natural thing. I just wanted to talk more about it. I live in a small rural area and I saw a lot of stigma surrounding the illness. And so this was my way to hopefully educate people a little bit about it, but also to make sure that, people really knew what it looked like from, the point of view of someone living with it.
I like how you describe your journey because, I recently did a reel on what a lifetime of someone living with schizophrenia looks like. And I don't think people understand. I think people automatically assume that you have hallucinations, delusions off the bat, but that's not the case. You can have what is called a prodromal phase where you have symptoms of depression. You may not really enjoy things. So like a lot of anhedonia, things are considered negative symptoms. It's not what it sounds like. When people hear negative symptoms, they think, oh, it's bad. But yeah. Negative symptoms is a scientific way of saying, like maybe you're not thinking as clearly. Maybe you can't focus as much. Maybe you don't have as much motivation. So that prodromal phase can look like that. And then you may be able to develop later in life the positive symptoms, which are also not necessarily positive, but it's a scientific way of saying hallucinations, delusions, illusions, and things like that. So I think it's helpful for people like you to talk about your experience because it just from you talking about it automatically destigmatizes it. So, help people to understand how schizophrenia can look across multiple different peoples, how there are different faces of schizophrenia, different presentations, and it really lives on a spectrum.
Yeah, absolutely. So, when I was first diagnosed, I was diagnosed when schizophrenia was still broken up into subcategories. So there was like disorganized schizophrenia, catatonic schizophrenia, paranoid schizophrenia, and then I was diagnosed with undifferentiated schizophrenia, which just meant that I showed symptoms from all of the types. And I think most people received the similar diagnosis that I had, and that's why it really made more sense to have it as a spectrum, because no two people experiencing schizophrenia, or any mental illness for that matter, experience it exactly the same. And so I've been very lucky to work with a lot of different schizophrenia advocates now, including Michelle, Cecilia McGow, and a lot of other people that are making a difference by sharing their own stories. And what I've come to find is, although I have a lot of similarities in some of the things I've been through with either substance abuse because of my illness or because of other things that I had been through, when it comes down to symptoms, it never followed the same path. It was always, as you had mentioned, some people experience negative symptoms first. The very first symptoms I noticed in myself was paranoid thoughts that eventually led to delusions and hallucinations. And so it's definitely not the same when I talk to other people who have been through the diagnosis. There's always a little bit of difference in everyone's experience, and that's what makes it unique, and that's why it's so important that multiple people are sharing their stories, not just one person. It's so nice to have people from different backgrounds with different experiences so people can see a more broad picture of what it actually looks like.
And also, some of the things that you describe, paranoia, hallucinations, those could be symptoms of other conditions, So it can get very confusing for a lot of people because they may get a misdiagnosis, because people can have depression as a primary condition and then also have hallucinations with that depression. People can have trauma and they can have schizophrenia at the same time. It's like, because people who live with schizophrenia often have, situations where as children they were neglected because maybe a parent also had schizophrenia, or like, let's say they were treated poorly at school because the teachers didn't know what they were going through. They thought they were just like a bad kid, but they were really, having internal processes happening, and that's how they were dealing with it. So I think understanding that, like you said, people have different experiences, and that you could have multiple things going on at the same time in one individual is really important, which means that you're going to need different interventions, right? If you have a history of trauma, you're going to need support. You're going to need to feel safe. You're going to need to have your basic needs met. You're going to need to have therapy to trust people, right? One of the misconceptions that I've seen as a psychiatrist is providers particularly saying that you cannot use therapy when someone carries a diagnosis of schizophrenia. And I think that is totally not true.
Yeah, absolutely.
But I'm wondering if that's something you've encountered in your work as well.
Yeah, I've after my diagnosis and I got stable on medication, I've used different forms of talk therapy, and it's been less to deal with my schizophrenia symptoms and more to deal with some of what my schizophrenia symptoms have caused, because my hallucinations and delusions led to me falling into addiction. It led to being incarcerated. And that comes with a lot of different issues. It comes with a lot of trauma. And so I've used talk therapy to work through some of those things. And in the process, we do talk about my illness and what I've been through with it, because that's the catalyst to a lot of the issues I've had. And so that was something that, I do know that I've heard that before, and I've found personally a lot of help with that. And I also found that it's part of the reason I got so stable was by working through some of what I thought was real situations and identifying that some of the things that happened to me in the past were delusion based or were things I was hallucinating. It kind of helped ground me in reality. Like, I was able to differentiate a little bit more, because I was like, well, these situations that I thought happened the people around me in my life at that time can verify, like, no, that never happened. And as I kept doing that, the more stable I felt, like, okay, maybe I'm getting better at identifying, like, this is real and this isn't real. And obviously medication played a big role in that, but without talking through it, there's always that question of, like, was this something that actually happened? And instead of, like, constantly living with that, I was able to kind of work through it and really get down to the bottom of what was real and what was delusional thoughts or hallucinations.
I'm glad that you brought up medications, because a lot of people living with schizophrenia don't actually believe that they have schizophrenia.
Yep.
And it's one of the most challenging things to try to help and to really tackle in terms of a treatment plan, because if someone doesn't believe that there's anything going on, then what do, right? In your work with, multiple advocates and with patients, what have you found to be helpful when you reach that crossroad where, you're with someone that you care about, you have a family member and they don't believe that there's anything wrong. So you feel like your hands are tied.
Yeah. And that's something that my family had to deal with as well. So the reason that I fell into addiction and eventually was incarcerated was because I didn't think that there was anything wrong with me. So I was using drugs as a way to cope with what I was going through. But at the time, because of the level of delusion, I didn't think that I had schizophrenia. And this is, having been at one point in my life a caregiver for someone with schizoaffective disorder, like, I knew better than most people what the disorder looked like, what it entailed. And even with all that knowledge on, what the illness was, I still couldn't identify that in myself. And so for several years, instead of reaching out for help and letting people know I was struggling, because I didn't know, I instead was trying to self-medicate. And so what I didn't know at the time was my mom and my wife were preparing resources so that if I did reach out and I asked for help, they had everything ready to go for me. So that led to, like, really quick treatment and super early intervention, because even people with high levels of psychosis or that have diagnosed schizophrenia, we can still experience, like, moments of clarity as we're having, like, episodes of psychosis. So even though most of the time I was delusional, I was, like, thinking not clearly, I didn't think that there was anything wrong with me, there were moments where I would be like, maybe something isn't right. I would start to, like, identify, like, why can't I hold down a job like everyone else? Why can't I be in a quiet room by myself without having problems? And so little things in these moments of clarity, and that between, needing to be self-medicated, I started identifying that maybe there was something wrong. And so when I reached out to my mom and wife, they had these resources ready, and I didn't reach out thinking that I had schizophrenia. I reached out just because I was like, well, something's not right. I might need help with something. And had I not done that, I don't know that I would have gotten the help. When I talk to other advocates, I hear a lot of the same. It was friends or family who, when they reached out for help, were ready with resources and knew where they could go to get a doctor for a referral, and even, like, things like peer support and being able to talk to other patients and advocates can be really, really helpful. So that's from, my own experience and some of the few advocates that I've worked with. There are also people who were in situations where they did get involuntarily admitted and they were, put on medication through either a court order or something like that. And some people have had success with that. I do know some people who it caused, like, a lot of distrust in the medical system and then in their friends and family. So I do, always hope that that's a last resort. But I do know that with some people, they might not get those moments of clarity. And so I have seen that be an effective way to get someone the help that they can't ask for. But my hope is always that it doesn't get to that point, because it can be very traumatizing for everyone involved, for the doctors, for the patient, and for any police officers involved. So it's just in hopes that, people do reach out for help and that those resources are ready and available. And that's a tough thing too, is making sure that they have access to that care.
Well, and in today's day, you really don't get admitted unless you are a harm to yourself or others.
Yep.
So that does leave a lot of room for people to not necessarily get the treatment or the support, especially if they don't think anything is wrong. So in cases where, I have a lot of family members who ask me this through DM and just reaching out to me, and they say that, I have a loved one who's living with schizophrenia. They have so many talents. They can achieve so much with their lives if they were stable, if they were taking care of their mental health, but they're not. In those situations, what do you do? Because you're not necessarily a harm to yourself, immediately, right? In the long term, yes, right? Because you will likely develop medical issues if you're not taking care of yourself and so forth. But the immediate threat isn't there. And if you're not someone who's having hallucinations or delusions that are violent in nature, then you're not really a threat to others. So in cases where you do have, family members asking you, how do I support my loved one, when they don't think anything's happening and the healthcare system won't help me because they're not giving consent, what advice do you give in those situations?
It's advice that I think people don't like to hear, but my advice is keep letting them know that you're there for them and hope that they reach out. I do look at mental illness very similarly to how I look at addiction. Someone has to ask for the help to be able to receive it. And I know that's not the answer people love to hear, but the only other option is forced treatment. And although that does work for some people, like I said, that can lead to a distrust in systems. And so even if that person gets immediate care, when they get stable, they might not continue with that care. They might not have the, when I finally got on medication, I had made that choice. So I felt very involved with my own care. I felt very like I had control over it. And that's why I continued with it and got to the stability I have today. The unfortunate thing I've seen with some people who get put into treatment involuntarily is that once they get stable, it wasn't their decision, so they don't feel the need to continue with it. So that my advice is always the least the advice that people least want to hear, which is just be there for them, let them know that you're concerned, and have those resources ready.
Yeah, I think, it is very good advice. And you're right. It's not what people want to hear, because when we love someone, we want to act. It's very difficult for us to just watch and wait. But in some cases, that is really all that you can do. And you also have the ability to take care of yourself, right? Because as a caretaker, that when you have someone, so much responsibility, a lot of times you neglect yourself. You don't take care of your own needs. And so for families who are listening, make sure that you're taking care of yourself. Make sure that you're getting the therapy to support your emotional needs, your psychological needs, that you're taking care of your nutrition, your physical health, that you're connected to others, because you matter too. And, when your loved one is ready, you want to be healthy. You want to be capable, right, to help them and to support them. And it's not what people want to hear, but it's so important that they do hear it.
Yeah, and
what are the do's and don'ts? I'm sorry.
Sorry. I was just going to say one more thing. When I give that advice, I give it from the point of view of not only a patient, but also a caregiver. So I understand the frustration there, and I understand how hard it is to watch a friend or family member go through a diagnosis like schizophrenia. And that's why I know it's not what people want to hear, but I stick to that advice because I've been there on both sides,
Yeah, that is a unique perspective, right?
Yeah.
That you can speak from both sides. Let's pivot away from people who don't know what they're living with and haven't fully accepted that yet. But how do you have discussions with people who are open about living with schizophrenia? What are the do's and don'ts? What should you never say to someone who's living with schizophrenia?
I get a lot of people who really think they're trying to be helpful, and they'll try to tell me things that they believe in that can be very dangerous. So part of being on social media is, my life is comment sections. And so I get unsolicited advice or comments all the time. I've had people tell me that my schizophrenia is a demonic possession. I've had people tell me that my schizophrenia is a spiritual gift or some sort of awakening. And I've had people tell me that it's also me being able to speak to people who have passed. And so I never want to diminish someone's beliefs. I know that there are a lot of people who genuinely believe these things and they don't mean them to harm me. But when you say something like that to someone who suffers from delusional disorders, it's very easy for that person to fall into a delusion surrounded by one of those ideas. In fact, religious delusions are the most common type of delusion for people living with schizophrenia. And so as much as I appreciate that everyone has their own beliefs, it can be really dangerous when people are trying to say that to me on my page. And they probably don't realize that, right? I also get a lot of people who, because I'm high functioning, quote, I don't like the term high functioning, but that's what I use. But because I am more stable and I don't appear to be severely mentally ill most of the time, I get a lot of people that fake claim. They claim that I'm using schizophrenia as a way to become popular on the internet. And so to me, what that shows is that people are more likely to believe that a person is faking an illness than a person, they're more willing to believe that a person is faking schizophrenia than someone is living a somewhat comfortable life with medication and treatment. That's how bad the stigma is around schizophrenia. And that's also a huge misconception. There's a lot of people that think if you have a schizophrenia diagnosis, you have no chance at living a successful, happy, quote unquote, normal life. And so when they see me functioning day to day and then having, breakthrough symptoms of hallucinations or, negative symptoms, they assume that it's faking because they can't fathom the idea that someone with schizophrenia could be functional.
I mean, I think that's so well said. And I remember when I was in training, one of the most brilliant doctors who was training me in the hospital was living with schizophrenia.
Yeah.
And, from the outside, you would never know it, because if you didn't know that people can present in all different ways, right? Especially if they're not someone who has hallucinations or has the positive symptoms all the time, right? You would never know. And so I think that, combating that stigma and talking about it openly the way that you are doing on social media is so helpful for so many people. And, living with schizophrenia is, I'll say it, it's not a gift, right? Mm-hmm. That's like saying living with diabetes is a gift. It's something you have to manage, right? You have to be mindful of your lifestyle choices. You have to think about things so that you don't, stop doing the things that you value in life. So I think that really needs to be challenged. There's so much misinformation out there, especially in terms of mental health issues. So, I really hope that people really take this to heart and they see that, this is a spectrum, right? I study high functioning depression in my lab, and there are many people who walk around smiling, getting things done, but they're struggling.
Yeah.
And they don't get the support that they need, right? Because people say, well, you don't look depressed, you got it all figured out. But we all have our issues. We all have our struggles. We all have our challenges. We all have mental health, just like we all have physical health. So we all have to nurture and maintain our mental health. Not all of us want to acknowledge our mental health, but we have it, whether you want to or not. If you have a brain, you have mental health that you need to nurture and maintain.
Yep.
I always ask my experts about a time in their lives when they were struggling on the inside, but on the outside, they had it all. It seemed like they had it all figured out. Everything was put together. They were thriving. They were doing wonderful things. No one knew that they were really struggling. And how did they get through it?
Yeah, so, for a very long time, after my diagnosis, there was several years where I was going through changing my meds and getting on meds that made me more and more stable. And through this whole time, I didn't have social media. I wasn't making a difference. I wasn't sharing my story. I wasn't even talking to people about my diagnosis because I was so afraid of the stigma. So when I started social media, and my social media started growing very quickly just from talking about, symptoms that I've dealt with, sharing what it's like living with hallucinations and delusions, my TikTok blew up very quickly. And very early on, when it was just starting to grow, I did what everyone on the internet does. I call it the Instagram life filter, where I wanted to show everyone how well I was doing, and I refused to acknowledge anything was going wrong. And so one of the hardest things when I was starting was I was pretending like I was doing really well and things were fine and medication was good. And that whole time I was dealing with constant symptoms. I was dealing with a lot of mental health issues too because of online hate comments and trying to manage a full-time job and try to do more advocacy. And so at one of the times I think people really thought that I was the most successful because I was starting to do this, and I was looking at quitting my job and doing advocacy and social media full time, and no one knew except for probably my wife that I was struggling so much every day. I couldn't sleep. When I was sleeping way more than I needed to, and it was I could not find a healthy mix of anything. I wasn't eating right, and I was having more symptoms than I had had in the previous 5 years. And so all of that, boiled to a point of burnout where I had to take time away and come back. And now I know a lot better that, I need to be not only taking care of myself, but I've become a lot more honest with the people that follow me too. Everyone knows that Kody has bad days. And that's something that I think is just as important as showing, yes, I'm a functioning person with schizophrenia. And it is possible for people with schizophrenia to be functional, successful, and happy, but here are some of the realities I still live with. And that's something that I couldn't do early on because I was too ashamed. But at that point, I'm just feeding into the stigma that already exists.
Well, thank you for sharing that and for being vulnerable, because I think that many of us walk around wearing a mask when we're really struggling. And if we just showed a bit more vulnerability, we'd get the support that we need and that we deserve, that we're worthy of. Especially when you're an advocate and you're pouring so much into the community, that community wants to support you back, but they have to know. Where can we follow you? Where can we find you and keep up with all the wonderful things that you are doing?
Yeah, so my speaking website is kodygreen.com, but you can follow me on TikTok, YouTube, and Instagram at Schizophrenic Hippie.
Thank you so much for joining me on The Vault.
Yeah, thank you so much for having me.